Hello, I'm Mark Rothstein, and welcome to my latest video on COVID. Today's topic is what to do now after the end of the emergency public health declaration by the federal government. Before beginning, I want to start with my usual disclaimer. I'm not a physician, and nothing I say should be considered medical advice. I'm also not an epidemiologist, virologist, or other type of scientist. My background is in public health, ethics, law, and policy. I've served as an advisor to the CDC on coronavirus policy for many years, and I've written widely on the public health response to COVID. In addition to updating you on where we are with the disease, this video will focus on the effects on individuals of the change of the legal status in terms of the emergency declaration at the federal government level. I also want to talk about how individuals can best protect themselves during the lessening of public health measures, and also some important issues involving employment and healthcare. I want to begin by sharing some very good news with you. By every measure, deaths, hospitalizations, and total cases, COVID rates have declined significantly from the 2021 highs. For example, today there are about 150 deaths per day from COVID, which represents a small fraction of the deaths per day during the darkest days of the pandemic. Today, more than 90% of deaths are among people 65 and older, many of whom were medically frail before they became infected and therefore were unable to fight off the COVID infection. Unvaccinated people have death rates 5 times higher than those who have been vaccinated. And children are 1,000 times less likely to get serious disease than adults. Some people may look at these numbers and think, well, there's nothing to worry about. I disagree. If you get COVID, even if you don't require hospitalization, it is certainly no picnic. The severity of symptoms varies widely among individuals, but fever, fatigue, respiratory distress, and other symptoms can be debilitating. Besides medical issues, the period of isolation and recovery is often very disruptive to one's family, work, and other activities. And merely testing positive for COVID represents a risk of transmission to people who are immunocompromised or otherwise at increased risk. In addition, there is not yet any effective treatment for some of the most serious symptoms of long COVID, which may extend for many months. The latest dominant Omicron subvariant, which you may have heard of, is called XBB 1.5. And it's thought to have arisen on the east coast of the US in the fall of 2022. It appears to be more highly transmissible than prior Omicron subvariants, and it has what's called an increased capacity for antibody evasion, which means that it's more likely to make you sick. Although it does not appear, at least at the present time, that it will lead to more severe cases. Now, what about the effect of ending the public health emergency, which occurred on May 11th of this year? I think there are 5 main issues that I would like to address that I think will be of interest to you. The first one concerns vaccines. Vaccines will remain available for all adults and children, and they will still be free. If you received a bivalent booster more than 6 months ago, and they became available in the fall, as you may know, I think you should definitely get another booster. I also think it is advisable for people who care for or who have regular contact with someone at high risk to receive another booster, but they may not be available because if you are not in a high risk category based on age or health status, they may consider you to be ineligible. It's also uncertain whether we're starting down the path of regular periodic boosters, and boosters will become the norm for people every 6 months or every 12 months, the way you get an annual flu shot. Second issue is the COVID home test. They may no longer be covered by health insurance after May 11th, but many community and pharmacy programs will still provide free test kits. And of course, this is very important. Some schools make the test available for children and their family. And what I recommend is that you check several places until you find one that has free home test kits available. It should be around somewhere, except it's not going to be a regular specific place all over the country. The third issue involves treatment. According to the CDC, drugs such as Paxlovid, which prevents already infected people from developing severe COVID, will remain available for free while supplies last. Nobody knows exactly how long the supplies last. The best estimate is that this will probably occur in the fall of 2023, when all the drugs that were purchased previously by the federal government will run out. At that point, drug manufacturers can begin charging for the drugs, but it's widely believed that low cost or even no cost coverage will be available from public and private insurance plans, and even uninsured should be able to get free treatment through public health facilities. The fourth issue, I received a question about what effect does the end of the emergency declaration have on the emergency use authorizations that were issued by the Food and Drug Administration, the FDA. And according to the FDA, their position is that these so-called EUAs for vaccines and drugs are not affected by the end of the public health emergency, so no change there. And finally, on court decisions, there were a number of cases decided regarding mandatory masking and vaccinations and other public health topics. Most of them concern the validity of regulations or executive orders or statutes. And in the last year or so, many of these mandate laws have been repealed. So a judicial decision upholding such a law or regulation is no longer controlling because the law itself is off the books. One of the questions that I received the most recently is some form of what should high-risk people do now to protect themselves? And in my view, the greatest threat from COVID is not that the government did not extend the public health emergency declaration. It's that many people now think that COVID is over and that public health measures imposed in the last 3 years were an overreaction. Keep in mind that during the last 3 years, 1.1 million Americans died of COVID, and at least 200,000 of those were completely preventable. It is clear that mask wearing is effective in preventing the spread of respiratory diseases. It's much less clear that mask mandates are effective because many people resist wearing them. They don't want to be told what to do. They think they know better than the public health officials. And even when they wear them improperly, and it's difficult to get, the policing, if you will, of non-compliant individuals. Another troubling figure is that studies have shown that 1/3 of all public health officials in the United States reported receiving threats during the pandemic, and many have left their jobs. So I think it's clear that hostility to public health does not bode well for the future, including when we have the next outbreak of an infectious disease, which it's only a matter of time. Whether it's from a new COVID strain or avian influenza or some other source. And these same very detrimental attitudes also affect the way high-risk people can protect themselves against COVID today. So what do I advise? Well, vaccination, boosters, avoiding crowds, masking indoors, having virtual rather than in-person meetings whenever possible, making sure that there's good ventilation indoors, prompt testing after possible exposure, and isolation and medical treatment after a positive COVID test still remain the basic rules. After that, individuals need to decide how best to accommodate the risk of exposure with the demands of their daily lives. Personally, I can tell you that I used to travel frequently, giving lectures and going to meetings all over the country and even internationally. And I have no plans to travel anywhere, basically, for the rest of 2023. The degree of your personal protection measures, I think, depend on your risk tolerance. And that will vary based on your health, your personal and family situation and obligations, and also your psychological state. You need to be safe, but you also need to feel comfortable in whatever it is that you're doing. Two other issues that I have been asked to comment on. The first one is related to employment. And with vaccination and mask mandates largely eliminated, how can you protect yourself at work? I think the goal must be to convince your employer to take certain essential measures for the protection of high-risk workers, even if not legally, even if they're not legally required to do so. The Americans with Disabilities Act and comparable state laws require employers to provide reasonable accommodations for individuals with disabilities. In the context of COVID, the need for accommodation depends on several factors, such as the nature of the work, the number of workers, how closely together are they working? Are there customers that are in close proximity? Whether the work is indoors or outdoors, and all these other factors. And one of the main reasons that it varies is because there are so many different industries and different types of jobs. And I know many of you who are watching this are in the entertainment industry. One question I received asked about the new SAG COVID accommodation rules, and I asked Julia what she would advise. And I agree with what she said, and let me go through it for you. She said, I would wait until the deal is closed, meaning that the contract has been signed or the terms agreed. Then the actor, or preferably the actor's agent, should ask production for the testing accommodation outlined by the SAG-AFTRA agreement for immunocompromised or high-risk persons. If the actor is then fired or is told they are no longer needed, they should file a complaint with SAG as well as the EEOC, the Equal Employment Opportunity Commission, which enforces the ADA. Julie went on to say that the production company can ask for reasonable documentation of the health condition of the actor. A letter from a physician stating that you are in a high-risk category and require accommodation should be sufficient. The production company probably will not have a duty to provide accommodations where the actor is living with a high-risk person, such as an elderly grandparent. Parenthetically, the ADA also prohibits what's called associational discrimination, such as discrimination against individuals who have a child or a spouse with a disability. But this theory has not been recognized in the COVID context, and generally speaking, there is no duty to provide accommodations to people who themselves do not have a disabling condition. In terms of healthcare, many institutions and healthcare providers have unfortunately abandoned masking. One important question is whether there's anything a patient can do about it if a provider refuses to wear a mask. Personally, I think it is unprofessional and unethical to refuse a high-risk patient's reasonable request to wear a mask when they are in close contact. And you can just look to the major documents of medical ethics to draw this conclusion. The first principle of the AMA Code of Medical Ethics provides, quote, a physician shall be dedicated to providing competent medical care with compassion and respect for human dignity and rights, end quote. And of course, many people are familiar with the Latin phrase primum non nocere, which means first do no harm. It's a cardinal principle of the medical profession. So for reasons of infection control, as well as respect for the patient's dignity, masking is clearly appropriate in certain clinical settings. Can you imagine surgeons and nurses deciding not to wear masks during surgery? The problem is how to remedy this. Patients often have little choice about their doctors and healthcare institutions. To the extent that patients do have a choice, they ought to seek care only from physicians who will honor their reasonable request. There are numerous avenues for filing complaints. If they don't comply, you could complain to the hospital administrators or the state medical boards or the Centers for Medicare and Medicaid Services and all sorts of other places. Unfortunately, I'm not aware of any instances in which these complaints were successful, although that doesn't necessarily mean that they don't exist, because if a patient convinced a hospital to change its policy, it probably wouldn't be reported in the newspaper. So in conclusion, I just want to re-emphasize that we are in a much better place with regard to COVID than we were before. In the 5 or 6 prior videos that I did, it was, how bleak is bleak. People were dying. There were no treatments. There were no vaccines, and we didn't know where it was going to end. But by the same token, even though things are better, not everyone is back to pre-COVID life, and nor should they be at this point. If no more lethal variants or subvariants emerge, and the level of infection continues to decline, and new therapies are developed, I think the risks and consequences of exposure will decline significantly. And that means that the quality of life will get better for all of us. So thank you for watching until the end. I hope this was helpful and answered some of your questions. And as always, I wish you all the best.